Thank you, Mr. Tom. And we all know that challenges always goes with opportunities. So we're definitely excited about the future development of the clinical engineers around the globe. So now let's welcome Professor Dan Clark. He's a professor of clinical engineering at the University of Nottingham, and he will give a speech on how clinical engineers will solve the post-COVID healthcare challenges. Welcome.
Hello, I'm privileged to be here at the start of Global Clinical Engineering Week, talking about the role of clinical engineers in the post-COVID world. So my name is Dan Clark, and I'm a clinical engineer of something like 35 years experience. I'm currently head of service in Nottingham in the UK, where I support a large NHS hospital service. I've dedicated all of my working life to technology in healthcare, and I'll defy anyone to find a more rewarding career. Ever since I was a child, I've been drawn to exciting developments in science and technology. I remember watching the moon landings crowded around a small black and white television with my parents and the rest of my family. I was fascinated by how early computers learned to play chess, and I couldn't get enough of robot technology, these inventions from Hollywood sci-fi films being deployed into factories and warehouses. And even now, whenever there's a science or news story on the telly or in the papers, I'm glued. The recent pictures of far universe from the James Webb Telescope or the story of NASA firing missiles to deflect asteroids and meteors. It's perhaps not surprising, therefore, that I grew up to become an engineer. But not one working in space exploration, not one working in computers or even robotics. No, wonderful as those areas are, I chose to apply my enthusiasm for engineering somewhere completely different. I chose to be a clinical engineer. But news stories about clinical engineering have been few and far between. We clinical engineers don't generally get this level of public recognition. Our teams can sometimes feel undervalued. No red carpets, no flashing lights, no news stories, no tele exposure. We're often hidden away in the bowels of hospitals. We dedicated professionals ensuring that medical equipment is appropriate, legal, safe, properly maintained, used correctly by our clinical colleagues, and always available at the right place, in the right numbers, and at the right time. But we do so in a quiet, non-showy way. As a breed, we don't tend to seek out the limelight, being content instead with the knowledge that our high-quality patient care is dependent on the services and the skills that we provide. So, quiet backroom teams as we may be, then along came COVID and everything changed. Suddenly, from being in the background, we were thrust very much centre stage, whether we wanted it or not. For a short period, we were amongst the most important and the busiest teams in the healthcare system. Initially, this effort was concentrated on working with our clinical colleagues to identify medical equipment needed to meet the hugely increased, significantly increased demand for our patients coming into the hospitals. And then we were sourcing and ordering that equipment, commissioning it, deploying it, training and supporting the clinical staff in using it. All over the world, clinical engineers were supporting the COVID response by providing equipment and expert advice to ensure clinical colleagues were as well equipped as possible to respond to the unprecedented challenge that the pandemic brought. We've seen examples from all over the world where clinical engineers excelled. They went above and beyond to support patient need. For our own part, here in the UK, my team established a national resource allocation system where we evaluated new and emerging technologies on behalf of the UK government. Indeed, I was lucky enough to be recognised for this work and to get my own little bit of limelight when I received an OBE from the Princess Royal at Windsor Castle. For those of you not familiar with the UK honour system, and I mean why would you be? This is a very prestigious award, with only a few made every year, recognising outstanding service across any field, military, community, charity, sport or professional. My award was for services to clinical engineering, and particularly our response during the pandemic. And whilst I was the one who received the medal, this award was very much for the team of clinical engineers around me, and indeed for clinical engineers everywhere in the world. It was a very proud moment for me and my family, and I received many wishes, good wishes and praise from lots of people all over the world. So thank you for everybody who supported me in that. In all honesty though, and believe me when I say this, it's not false modesty, I also felt a wee bit embarrassed to receive this award. Yes, embarrassed. Because although I know I have had some degree of success throughout my career, and I have achieved my success locally and nationally, perhaps most notably during the pandemic, when we all face such pressure, I also know that I've been incredibly privileged throughout my career. When I reflect on my career, I realise just how lucky I have been and how much support I have received from colleagues, from professional bodies, from my family and from friends. My international experience has put my personal good fortune into even starker contrast. So many clinical engineers and colleagues around the world achieve great things in the face of daunting challenges and with none of the support that I've been so fortunate to receive. So initially, I did feel rather embarrassed that I was being recognised for my achievements when others were not. However, I realised that despite our natural inclination to stay in the background, we clinical engineers do need to celebrate our success and do need to broadcast them to help raise the profile of our industry and our profession. Because only when we raise our profile can we gain the recognition we deserve for the work that we all do. Only when we gain that recognition can our value be acknowledged. Only when our value is acknowledged will we see the investment in our resources, training and capacity building for our profession. And only through this investment can we build our profession, strengthen our teams and develop the services that we deliver. And ultimately, only through developing our services can we continue to maximise the potential of technology for the benefit of patients. And that, after all, is what clinical engineering is all about. So I got over my natural reluctance and promoted my personal success through news articles, web pages, Twitter and the rest, and used my award to showcase the work of all clinical engineers everywhere. And my plea now is for you to do the same. The time for modesty is past. COVID pushed us into the limelight, and we need to take advantage of this opportunity. We need to show off our achievements, celebrate our successes, and use these opportunities to raise the profile of our profession, which in turn will help us grow as a profession. Because the world needs us, even if they don't know it yet. The world is facing an enormous healthcare crisis post-pandemic. As we struggle to emerge from under the cloud of the COVID-19 pandemic, healthcare systems all over the globe are struggling to find sustainable business models. Feels like the challenges before us are dauntingly large. Populations in richer nations are getting older, getting fatter, getting more prone to long-term diseases like diabetes, coronary heart disease, dementia. Our life expectancies have risen sharply over the last couple of decades, and our demands on the healthcare system have risen even more so. We now expect to be treated for, and indeed cured of, conditions and diseases that a generation ago we were prepared to live with and indeed die from. And this is, of course, really good news story. As an industry, healthcare has been incredibly successful. But we are now, in many ways, the victims of our own success. There are more and more people expecting more and more healthcare, and the cost of meeting this expectation is increasing faster, much faster than the resources we have at our disposal. Whilst in poorer nations, access to healthcare facilities, medicines and technology can continue to be a huge challenge. A daunting challenge indeed, but a challenge that we clinical engineers will play a huge part in solving. Technology is already part of the solution, and it will become increasingly important to the well-being of patients globally. It will allow us to diagnose sooner and more accurately, preventing or improving healthcare conditions, and reducing the personal and healthcare system burden that they bring. It will allow us to treat more quickly and more completely, allowing people to be treated and discharged sooner and returning to improved health conditions with reduced costs to the healthcare system. It will allow us to care for people in their own homes or in remote settings and communities, supporting their daily living activities. Might even allow us to monitor people and proactively intervene, preventing them from becoming ill in the first place. It will also help us to reduce our carbon footprint and move us towards our net zero ambitions. And it will allow us to provide financially sustainable healthcare systems into the future so that we can continue to support the health and well-being of people all over the world. And who do you think is going to develop this new technology? Who will evaluate it and make it applicable to healthcare systems? Who will adopt it, deploy it, make sure it works effectively and safely for the benefit of patients? Who will maintain it, service it and repair it? Yes, clinical engineers, of course. So if all this new technology, as amazing and exciting as it no doubt will be, if all this new technology is going to be able to deliver the benefits for our patients, then the world is going to need all the clinical engineers it can get. We're going to need a strong, vibrant, well-connected community of clinical engineers. We need a confident and growing profession. We need resources, training and capacity building. And we need to have a shared platform to promote everything that we need to best serve the world population expectations. But these things don't happen spontaneously or on their own. They need work, they need effort, and they need commitment. The Global Clinical Engineering Alliance and the IFMBE Clinical Engineering Division are working together to support a series of projects to help support and grow our profession. We're working on capacity building projects to ensure we have enough of the right people with the right education, training and appropriate management skills. There is currently a global survey to support the definition of the body of knowledge, what we do as a profession, and building towards a clinical engineering health technology management maturity model. And we're working on a project to measure the impact of our services. We know the value of clinical engineers to the healthcare system, but how do we demonstrate this value to our executives, to our politicians and to the public? This project looks at capturing and measuring the value of the work we bring. Then we're also working on credentialing projects to support the recognition of learning and experience from staff from different parts of the world with different backgrounds and different opportunities. And we're also supporting a number of specific projects on behalf of the World Health Organization, including a nomenclature review, a number of training videos, innovation review, and many, many more. And there are so many ways you can get involved and lend your weight to this effort. You can support any of the above projects. Just contact me directly or Tom Judd. My details are in the slides. Or work on raising the profile of clinical engineers in your own region. Why not write an article about the success you or your teams have had and get it published in your local journals, or indeed submit it for consideration to the Global Clinical Engineering Journal. Again, contact me directly for further information, because we're always looking for good news stories about engineering. Why not offer to review manuscript? Again, we're always looking for volunteers. Or to become a mentor for junior staff. Organise an open day for your department and invite your senior clinical colleagues or your hospital directors to come along. GCEA and IFMBE both have awards every year, so why not put your team or your colleagues forward for one of these? Utilise social media, tweet pictures of your work and short notes about your achievements. If you're into such things, you could always make a video on TikTok or something similar. There are so many ways to promote our profession, so don't be embarrassed. Be proud. Now is a brilliant time to be a clinical engineer. There are, of course, huge challenges ahead. Of that, there is no doubt. But engineers love a challenge. That's what we do. And what better challenge could there be than one which delivers safe, effective, available healthcare to the whole world? So, on this Global Clinical Engineering Week, let's be proud of the work we do. Let's celebrate our success and shout about them from as often as possible and as loudly as possible. Let's grab the recognition we so richly deserve. But let's take nothing for granted. We need to work to support and grow our profession. So if you can, find a way to raise the profile or support some of the projects to grow this wonderful profession that we're privileged to work in. Have a great Global Clinical Engineering Week. Thank you very much.